In the United States, there's a tremendous treatment gap in terms of what we know works for the treatment of opioid use disorder and what patients are able to access in community settings. We conducted a retrospective longitudinal cohort analysis among Medicaid beneficiaries. We had access to Medicaid insurance claims for 12 million beneficiaries across a handful of anonymously reporting states. And we looked at the patients who were entering treatment for opioid use disorder or opioid addiction who were being treated with buprenorphine. In particular, we were interested in patients who were successfully retained in care beyond a minimum of 6 months. This is actually a subset of people who initiate buprenorphine treatment because, unfortunately, most people drop out of care within a few weeks or months. Or the policies of some programs or prescribers is that patients are only allowed to receive a few months of medication before being tapered off. In this case, we wanted to look at patients who are successfully retained long-term, beyond a minimum of 6 months, to see how, over time, their outcomes following medication discontinuation may or may not change. We created cohorts of patients who were successfully retained for 6 to 9 months, 9 to 12 months, 12 to 15, and 15 to 18 months, and then looked at the window following their care discontinuation to see how they differed across an array of clinical outcomes that would be very concerning. Medically treated overdose, presenting to emergency rooms, being hospitalized, or receiving an opioid prescription, which likely would be a marker of relapse or at the least poorly coordinated care between providers. We were expecting to find that patients who were retained beyond a year or a year and a half, that they would have much better outcomes, that following discontinuation, they'd be much less likely to have a medically treated overdose, much less likely to be hospitalized. But we didn't really find that. In fact, what we found was that after discontinuation, no matter how long people were on buprenorphine, even up to a year and a half, there was an extremely high rate of overdose risk. We weren't able to detect overdose that didn't present to hospitals or that may have been fatal in the community before receiving medical attention. And yet, even so, we found that 1 in 20 of the patients experienced 1 or more medically treated overdoses in the months following medication discontinuation. We also found that almost half of these patients wound up in the emergency room 1 or more times. About a quarter of them received opioid prescriptions. All of this was alarming and much worse than what we were predicting. We did find somewhat of a protective association, and that the patients who were retained for 15 to 18 months, they were less likely, statistically, less likely to wind up in the emergency room or get hospitalized, but it was a minimal difference, something like 49%. The odds might drop down to 42%. But overall, most of the patients had very high rates of adverse events following buprenorphine discontinuation. Now, in this case, we don't know why patients stopped buprenorphine. It could have been that their insurance plan changed, that their provider closed practice. It could be that the patients chose to taper off because they were doing so well, or it could be that they were doing poorly and this was a sign of relapse, that they discontinued. We don't know why they discontinued, and it was likely a mix of reasons across these 9,000 patients that we were able to study. Regardless, what we found was that even among the patients who were in care for over a year or a year and a half, those patients still had alarmingly high rates of adverse events following treatment discontinuation. Currently, in the United States, most patients only receive buprenorphine for a few weeks or a few months. This study suggests that that is woefully inadequate, and that when patients quit buprenorphine or discontinue for whatever reason, it's highly probable that in those few months following discontinuation, that they will wind up in the emergency room, possibly even have an overdose. It suggests that the post-discontinuation window is a critical time period, if not a period when emergency services need to be activated to proactively find patients, to reconnect them to care, and to try to reduce the risk of having some sort of adverse event that we're otherwise seeing across these thousands of patients in multiple states.